Hi everyone, welcome back to the Pulse TV Health Corner. I'm your host Kathleen, and with me studio today is
Mr. Boni Masike.
And today we are going to talk about cervical cancer. In this channel, honestly, we look at things to do with healthy issues, in terms of family planning. We look at healthy conditions. We have these long-term health conditions, short-term health conditions. How do you go about them? How to avoid some healthy issues? Prevention, they say, is better than cure, etc. So for more videos and knowledge, or as far as our health is concerned, because your health is our concern, we kindly ask you to subscribe, like, share and comment on this particular video, and subscribe to our channel too. So tumepotea sana, but we are back, and trust me, I will be bringing you content from this side. This man here, he's an expert. He has a lot of knowledge as far as health is concerned, and it's good that he shares it to the world so that we can know where we're doing it wrong and where we are doing it right. So Mr. B, when we talk about one of the major actually problems and one of the major worries of an African woman today is cervical cancer.
Sure.
And many times cervical cancer, some of the women who have suffered it actually face a stigma from not only the society, but even from their own husbands, their own boyfriends. So today I want us, you tell us what is this cervical cancer. We will start there, and then we will move to other questions that I have, like what are the predisposing factors, or like what are the causes or factors that put you in a situation that you are more vulnerable to getting cervical cancer. Do we have cervical cancer in men, and what happens in that particular case, and is there like a way of preventing or curing cervical cancer, etc. So Mr. Boni, what exactly do we mean by cervical cancer?
Thank you so much. And before maybe I respond to that question, allow me to give you some funny statistics. In African countries or in developing countries, cervical cancer and breast cancer are the leading cancers that are killing our women and female or girls. And it's exceedingly awkward. In the developed world, like in America and in the European countries, cervical cancer and breast cancer is a nothing. You've been abroad, and I think you know this. And the reason is our women and our girls, they don't have this health-seeking behavior of just coming in a healthcare facility and ask, let me do a screen of either breast or cervix. But where you are in Germany, I know you know that women just walk in a hospital and say, I've come particularly to screen for breast cancer or for cervical cancer. Now, back to your question. You asked me what cervical cancer is. Ni saratani ya njia ya uzazi in Kiswahili. And basically, there is a virus called HPV, in full is human papilloma virus. It is a virus that just affects the cervix, and when it affects the virus, it continues eating the cervix until now it's a cancer. That's how I can explain shortly.
Yeah, Mr. B, thank you so much. Cervical cancer ni iyo saratani ya njia ya uzazi. You said that, and you alluded to one thing that outside there abroad, women just wake up and march into an health facility to a gynecologist, and they say nataka kupata nataka body testing, in terms like I want to test for cervical cancer, breast cancer, etc. Something that is not common. I know you have working in an health setup here in Kenya. You have said that it's not common with our Kenyan women. Why do you think it's not the case with our African women, that they can wake up, mtu amke tu, and then say, I just want to go and test for this, like, any form of infection? What do you think?
Yeah, the reasons are very wide, and you might not maybe put a finger on one of the specific reason why our women don't like, not just women, even men in their own diseases. But number one, when you're introducing it, you said there's some people put some faith and thinking about this cervical cancer. Remember, it is a cancer of a reproductive system, and people tend to associate it with promiscuity, and so people fail to go and have a test because wanafikiria if they have it watafikiria kwamba they are promiscuous, and so they just fail to come and maybe have that test. Number two, there's this thinking that it is expensive. Remember, here in Kenya, cervical cancer screening is free, but people think that is expensive. And then there's this cancer, people, mtu akifikia tu naenda kufanyiwa test ya cancer na haiwezi pona. So they fear just knowing their status, because wakijua hawana affair ya kwenda India, hawana affair ya kwenda Europe for treatment. I think that could be the reason.
Well, so according to Mr. B, why most women and men here in Africa don't do these tests is, one, it has to do with the stigma that comes with cancer. Because even right now, if somebody says they have cancer, you see a lot of emotions attached into the news than even looking at how it can be solved. But again, being the cancer of the cervix, he says that many people associate it with promiscuity, which according to him, from an health perspective, he says it's not about promiscuity. And there's always also the aspect like, I rather don't know that I have it than getting the news that I have it and then I have to think about it. But I also think, in as much as Mr. B, cervical cancer is free, there's free screening in the country, there's no information outside there to the public that actually they're supposed to get this. I think this is where the government and the health sector, you people, you have to man up your game and communicate this through the local channels that can reach the local mwananchi. Because I personally, the first time I went through screening, I was during my third year in campus. Okay. And all along, I didn't know that this thing is free until Kenyatta University held an health week. And I came to realize the dangers of this disease, and there was free screening, and then I had to go for the same. Okay. So I think also there's lack of information, especially for those people who have not made it to the cities and even these institutions of higher learning. So we cannot actually blame the African woman and the African man entirely on the aspect of victim and promiscuity. It also has to do with the available information in terms of screening, and also the readiness in some facilities to offer these services.
Sure.
Because you tell me it's simple that I can walk into an health facility and say I want this screening, but what chances do I have that I will not be told to pay?
Yeah,
that could be my question.
It's true.
I also think that in as much as there's that data, like there's that information that it is free, some of these clinics and health facilities and medical practitioners have made it a way of minting money, because the working class can always afford for that, and therefore they can be able to pay. But there's somebody, a poor Kenyan, who cannot be able to pay and he needs this, but is subjected to pay for it. So I think also it has also to do with accessing these facilities and how many facilities in the country offer these services also. Like if I asked you today, if we have to look, for example, in the 47 counties, we have different levels of hospitals. How sure I am today that if I walked into a level 3 hospital or a level 4 hospital or an health facility in my local region, I will get the services. Sure. So you see, I think it also has to do with the unavailability, apart from the reasons that you've given us. Now, having have known what is cervical cancer and people not like frequently testing for this, what could you tell us are the causes of cervical cancer? Like, what predisposes somebody, or what puts somebody in a situation like they are likely to get cancer?
Yeah, by the fact that is a cancer of a reproductive system, then unprotected sex is one of the major causes. And then failure to observe, let's say if you are not clean, failure to observe hygiene of your reproductive system. Because remember, when the virus accesses your cervix, it will just be there, but it needs a route to enter into your cervix, or into, it has to, like a root is like a wound, so that it can enter and start eating it. So if you are not hygienic, meaning there will be now a bacterial infection, let's say like cervicitis, when it opens up your cervix, so this HPV can now enter and start then causing the cancer. So basically, the predisposing factors are just hygiene and unprotected sex for me.
Okay. Hygiene and unprotected sex. And Mr. B, I would like you to give us a clarity as women of this country and Africa in large. There are these stories. Sometimes we are being accused. Let me talk for the woman now. We are being accused that we are responsible for the cancer that we are receiving, and people have pointed fingers to the shower gels that we use. For those ones who use shower gels, all these other perfumed soaps, hizi masabuni za kuoga, people have pointed fingers that, oh, hizo ndizo zinafanya tunapata cervical cancer. I have also seen people point fingers to the type of panties that we wear. Like, you get somebody, you say somebody, wakiambiwa wasishinde wakifaa tupanti twenye sijui tuna, these tongues, the African woman has been so much blamed for the cervical cancer thing in relation to what they use in terms of kuoga, and in terms of what they wear in terms of underwears. There's the cotton clothes. Some don't afford those cotton clothes, so that's the reason as to why wanapata hivyo. How true are these allegations outside there now coming? Like, we need to get it from an healthy practitioner. Am I at a higher chances of getting cervical cancer if I'm using a shower gel and
Yeah, I think we can do another video on the hygiene of the reproductive system of a woman, because it's so deep. And just but to kuguzia tu kidogo, number one, the vagina has the normal flora and fauna of that area that should not be interfered with. In fact, there are some bacteria that are just at the vagina that they should not be interfered with. So when you are using these shower gels or these soaps you are saying, maybe they're antiseptical, then they will go and destroy those bacteria, and they will predispose you to an infection, not necessarily HPV, so that when that infection is there, now the HPV, when it comes, it gets an easier route to enter and maybe predispose you to cervical cancer. And when you are speaking about these panties, especially the thongs that we are speaking about, remember, the human reproductive system in terms of the vulva and vagina has a close anatomical position with the anus. And remember, there are some bacteria that are at the anus. When they get their way into the vagina, they cause a pathology. And that's why, because the way the thong is just a strip that connects between the anus and the vagina. So these bacteria can move to the vaginal area, and then they cause an infection. Remember, cervical cancer is just caused by HPV. But when the bacteria come there and they cause a pathology, it opens up your cervix, so that now when the HPV comes, it is easier for you to have that cervical cancer.
Okay. So can we say like there are chances, or like they just act as predisposing factors?
Yeah, predisposing factors.
And all the time we talk about cervical cancer, I remember most of the time I have gone for screening. You find that it is women who are in the queues. I've never seen a man in terms of screening of cancer of the cervix. So it also leaves a question that I want to ask you.
Yes.
Does it mean that men do not, if you alluded to sexual transmission, and I think in this particular case we are talking about heterosexual sex, or heterosexual conjugal meeting. So I'm asking myself, does it mean that men cannot get this virus, or like they don't have this virus? It's only a virus that is only limited to women bodies?
Yeah, maybe we can say it's limited to women bodies. Remember, it's cervical cancer. Men don't have a cervix. Yeah, they don't have a cervix, but they are carriers. You see?
Okay.
Yeah, they are just carriers and they can transmit. But then we don't have a cervix, so we can never get a cervical cancer. Yeah.
So basically, men are carriers. So
Yes.
meaning they have that cancer within their body.
The virus.
It's only that virus within their body.
Yeah.
It's only that it doesn't manifest itself because they don't have a cervix.
Yeah, we don't have a cervix.
So I think this is where we need to also educate the public outside there, because when a woman gets cancer, men tend to run away, and they tend to blame women, ni ugonjwa yako, you know. And it could be surprising that it is you, the man, who has given this woman this cancer. So another that now question comes in, if a man goes for screening, itaonekana that virus?
Apana. The tests that we do, most of them, we will come on those, but we just maybe visualize on your cervix, and maybe we take the vaginal fluid. Remember, us, we don't have. But I think with the time, with the technology, we'll be able maybe to take a blood sample and try to see if somebody has. But as per now, what I do, we don't test men.
Okay, men are never tested,
For
but
now.
remember, men are carriers, and therefore, I think having protected sex, especially for ladies, if you are not married, is very important, and even frequent, I think, checkups with ladies and women to find out whether actually you are okay or if you are not okay. But more importantly is the knowledge that even men can carry that virus, and don't make cervical cancer look like an entirely creation of women by women for women. And now that we have seen the causes, and the possibility who can have it and who cannot have it in terms of sex or in terms of gender, from where you stand as a healthy practitioner and as a person who carries out these screens, what could you advise in terms of prevention of cancer? Because the way cancer is feared outside there, I think prevention is more important than getting it and starting the treatment process. So what do you think can be done, or what do you think are what can you advise women in outside there in terms of preventing cancer?
So thank you so much. So two quick things. Number one, let us look at somebody who is immunocompromised and somebody who is kind of not immunocompromised. And when I say immunocompromised, it means, let's say somebody has a pathology like HIV. When you have HIV, in Kiswahili ni ukimwi, meaning ukosefu wa kinga mwilini. So if you are such a person, then you are highly predisposed, because usually majority of these viruses are usually cleared out by the body. But if you have that if you are immunocompromised, you are likely not to be able to clear it by your body. And prevention in cervical cancer screening and management and cure is just the same, because remember, when it's a full-blown cancer, it cannot be cured, not unless otherwise, especially if it is in stage 3 and stage 4. In management and prevention, number one, if you have a child who is a girl between the age of 8 and 14, there is HPV vaccine. Kuna chanjo ya watoto wasichana kuanzia miaka 8 hadi 14, and we put that age because we have this feeling that they are not sexually active. We think like that, but the reality on the ground might be different. Remember, we only vaccinate in a chance that we feel that the pathology is not there. If the pathology is there and we are vaccinating, then you are maybe even destroying or making things be difficult. So at that age, we can give a vaccine. From that age, that's now from 15 to 29, there is a test we do, we call it VIA. And VIA is basically, we open up your cervix and we visualize it. We put there acetic acid and we can be able to visualize if there's a lesion. Remember, the way this pathology goes on or grows, it starts with a lesion and then it continue eating up your cervix until all the stages are complete. But remember, when somebody is infected today with that virus, it will take 10 years for it to be cancerous. And that's why when you come for this VIA test, we will do it. When we get it is negative, we will tell you you will repeat this test after 5 years. So it will take at least for a person who is immunocompromised, after the VIA test is turns negative, we always repeat it after 1 year. For people who are above 30 years, we can do a test called HPV test. This is where we just take a swab. In fact, you can do it yourself. You just take a vaginal mucus swab and then you bring to us, and then we'll take it to the lab to confirm if there is a presence of the viruses. Remember, this HPV test, after we confirm that you are positive, we'll have to do again a VIA so that we can know where is the lesion. And for people who are above 50 years, we can also do what we call pap smear. For HPV, we always do from 30 and above. But when you want to confirm if the lesion is on the cervix, for 30 to 49, we do a VIA. But for 50 and above, we do a pap smear so that we can know where the lesion is. Now, this is where the treatment comes in. And that's why we tell women, please come and screen. Remember, I've said, when you are infected by the virus today, let's say today that virus is present at your cervix, it will take 10 years to become cancerous. But between these 10 years, the processes of being cancerous, it will start by making a lesion. A lesion ni kama kidonda. So that lesion, when we see it on that cervix, now that's when treatment comes in. For me, if I see that lesion, maybe it's by pap smear or maybe by a VIA test, we have machines like where I work. We have what we call thermoablation. In short is tuko na machine ambayo tunaweza choma. We just choma that kidonda where the virus is eating your cervix, tukichoma, and then they just die completely. And then in other places like Kenyatta, they have what we call cryotherapy. Cryotherapy, this introduction of nitrogen gas that is freezed beyond -10 degrees Celsius. So it will come and freeze where the kidonda is, and the viruses will die automatically. So within this period of 10 years, tukipata kwamba there is a lesion, we will be able to treat you, and then we'll continue monitoring you. And for people who have turned positive in these screen tests, when we treat them, it doesn't proceed to cancers, and that's how we can prevent cervical cancer.
Wow, I see. It's really an interesting prevention thing, but you've given us more of a medical prevention, like the regular testing, and then once you find the problem, you are able to treat it. And you've said that treatment it is before it reaches level 3. So my question is, how long does it take to reach level 3 or level 4 cancerous? That treatment is a stage where treatment is not guaranteed.
So when we are doing a visual test, that is what I'm calling VIA, then we always expect 3 answers or 3 tests outcomes. The first one is positive, the next one is negative, and the third one is suspected for cancer. Where I work, we cannot manage suspected for cancer. So if you are negative, let's say you are HIV negative patient, when it's negative, we'll tell, okay, go home, you will test after 5 years. If you are HIV positive and it turns negative, say, okay, you are okay, go home, you will come back after a year so that we can repeat the test. If it's positive, we have to calculate that lesion in correlation with your cervix. Which percentage is it? If it's more than 3/4, we will send you to Kenyatta National Hospital. They'll do what we call a lip. Currently, where I work, we don't do that. And that's just a machine that will cut your cervix where they see that the lesion is, and then it will remove it with the viruses, and then you will just, the cervix, it usually grows very fast, it will just grow. And then if it's less than this 50%, is that what we can treat. If it's suspected for cancer, you will be taken to these referral hospitals, and they'll be able to do some investigatory studies, and they'll be able to stage it. The cancer is usually staged, and I think those ones are done at a high level by the oncologists, and they can easily stage it. Remember, stage 1 and 2, you can easily manage it, maybe by chemo or radio therapies. But if it reaches 3 and 4, it means the cancer has moved from one organ to multiple organs, and so to treat it is usually very difficult.
Okay.
Yeah.
So there's hope for for cancer management, and I think we have had cases of cancer survivors, and I also believe we have cases of cervical cancer survivors. And maybe Mr. B, before we close today's show, I wanted to find out, we have had also this myth that most women get cervical cancer after birth. Yeah, like unasikia eti alienda akazaa, venye alizaa, after that she developed cervical cancer. I want to understand what is the relationship between a woman giving birth and getting cervical cancer.
Yeah, there is no direct relationship between the two. As I've said before, cervical cancer is just caused by the presence of human papillomavirus, and then it gets its roots through the cervix, and then it starts eating up your cervix. But during the birth, and that birth I'm sure is SVD, the normal spontaneous vertex delivery, SVD, where mtu anazaa through the normal lapasoliwi. That's what I'm meaning. Remember, when the baby is passing via the cervix, it impacts a lot of pressure on the cervical walls, and usually when you don't get a good midwife, you are likely to rupture or get some tears or kind of such of things on your cervix. Remember, if there is any presence of that virus around there, it will get its way easily into the cervix, and then it starts eating up your cervix. So that could be the relationship between the cervical cancer screening and the SVD delivery.
Okay, thank you so much. So ladies outside there and women, actually don't fear to give birth, because there's also a myth outside there that mtu akizaa wingi wamepata cervical cancer after kuzaa. As you can hear from Mr. B, there's no direct relationship between cervical cancer and giving birth, unless and otherwise you had a rupture from maybe your midwife was not keen enough, or maybe ulikatwa na you didn't also maintain good hygiene as a person, etc. But the thing here is there's hope for cancer, in terms cervical cancer, in terms of treatment. The cancer screening, cervical cancer screening, is free in some of these hospitals. We cannot actually point out to say that all hospitals, because we have had cases of women saying that they have gone and they have been told to pay, and NHIF doesn't pay for some of these services, in terms that wesi mgonjwa, you've just walked in and all those things. So I think that's all we had today in terms of cervical cancer. We hope that this video has shed some light unto you as a woman and as a man in this country, in this continent, and in this world, in terms of this particular disease. And we hope that we are not going to victimize ladies and women outside there who are battling cervical cancer. And we have also made you know why you should do frequent cancer testing. Wanawaume, when your women are going for this to the gynas, don't acha kufeel jealousy. And I think this is where the problem starts. Acha kufeel jealousy the another man or another woman is outside there akiangalia bibi yako. I think in the world of health there's no aibu, because ikikuja itakuja. So there's no aibu. Wanaume outside there, they are not also free for their women to go and see gynecologists, especially when the gynas are men. They are not ready to do that. I don't know what you will do from your health point of view to recommend for this. And I think men, let your women uangaliwe, because women outside there are suffering in terms of this cancer. Some have lost their lives because they didn't know it on time. Some are suffering with it. They don't want to come out and speak. wamechifungia, all those things. So if you have a feeling that there's a problem, kindly come out and speak. I think you will get medical attention and help from the relevant practitioners. And kindly, if you have any question concerning cervical cancer or any type of cancer, you can just drop it in the comment section below, and we will gladly pick it up and respond unto it in our next video. Otherwise, before I say bye from the show, I'd like to tell Mr. B to give us a parting shot. Yeah.
Yeah, thank you so much. Number one, we are encouraging family clinics where the husbands and they can accompany their wives in these clinics. And like where I work, I don't know if it's good to mention.
No.
Yeah. When you come with your husband in the clinic, we will give you a first priority utapanga line. Number two, please and please and please come for cervical cancer screening. Just come, it's free and it will really save you from a lot of things. And number three, as you've said, in the earlier stages when we screen you, we can assure you that it will be treated and you will be free. And as the host has said, please, 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 men, let us journey with the women in this process so that they can feel that we own up. Because as she has said, we could be the one who introduced these viruses to them. So it will always be good for us to journey with them during this process. Otherwise, thank you for this time.
Thank you so much, Mr. B, for your time and for your great knowledge. We hope that you have impacted individuals outside there in terms of cervical cancer, and I will be glad to host you again as we talk about other health issues and health concerns in the country. Until next time, guys, bye.